This video is for informational purposes only and is not medical advice. Ivermectin and Fenbendazole are not yet approved by the FDA for treating cancer. Always consult your doctor before considering any new approach. The stories and studies mentioned are based on publicly available information. His PSA was 736, stage 4, bone metastasis. His oncologist gave him 18 months. 6 months later, his PSA was 15. The scans were clear. Let me ask you something nobody else will. When your doctor said prostate cancer treatment, did he also mention you might lose your ability to perform in the bedroom? That you might need adult diapers? That the fatigue could be so crushing you can't even recognize yourself? Surgery, radiation, hormone therapy, they work sometimes, but they come with a price tag your body has to pay. Erectile dysfunction, urinary incontinence, bone loss, muscle wasting, depression. And here's the worst part. The cancer can still come back. You've heard about Ivermectin. Ivermectin won the Nobel Prize in 2015. It's on the WHO's list of essential medicines. And nearly 4 billion doses have already been given to humans safely. Here's what Ivermectin does to prostate cancer cells. Number one mechanism, it starves cancer stem cells. Cancer stem cells are the seeds that cause recurrence. They hide from chemo, radiation, and hormone therapy. But Ivermectin targets them directly by blocking certain pathways, so the cancer can't rebuild itself after treatment. Mechanism number two, they cut off cancer's fuel supply. Cancer cells hijack your metabolism through the mTOR pathway. It's like the gas pedal for tumors. So Ivermectin slams the brake, and studies show it induces oxidative stress and DNA damage selectively in cancer cells while leaving healthy cells alone. Mechanism number three, Ivermectin makes cancer cells visible to your immune system. Prostate cancer releases certain chemicals that tells your immune system there's nothing to see here. So but Ivermectin strips away that invisibility cloak. So your T cells and the natural killer cells, they wake up and they attack the cancer cells. A 66-year-old man has stage 4 metastatic prostate cancer, bone lesions everywhere. His PSA was 736. He added these two medicines to his protocol, to his standard protocol, and 4 months later, his PSA dropped to 15. The bone scans, significant improvement. His oncologist words were, I've never seen anything like this in 30 years of practice. This is not magic, it is biochemistry. Now, before you think Ivermectin is the old story, it's not. There's a second drug that works through a completely different mechanism, and when you combine them together, the result can even be more dramatic. So let me introduce you to Fenbendazole. Fenbendazole was made popular online by a man named Joe Tippins. Joe Tippins was a dead man walking. He had small cell lung cancer, metastasized everywhere, and was given 3 months to live. So a friend who was a vet doctor told him about Fenbendazole, a dog dewormer. So out of desperation, Joe tried it. That was years ago. Joe is still alive today, cancer-free. Mechanism number one, Fenbendazole destroys cancer skeleton. Inside every cancer cell are tiny fibers called microtubules, which act as a scaffolding to allow the cells to divide. Fenbendazole works by binding to these fibers and collapsing them. So this makes the cancer cells to freeze mid-division and self-destruct. Mechanism number two, Fenbendazole starves cancer of sugar. Cancer cells are glucose addicts. They consume 200 times more sugar than normal cells. Fenbendazole blocks glucose transporters and shuts down the enzyme cancer cells need to burn sugar. And so the cancer cell starves to death. Mechanism number three. Fenbendazole activates multiple cell death pathways. And it doesn't just trigger one pathway. It triggers multiple death pathways. Number one, apoptosis, which is programmed cell death. Pyroptosis, inflammatory death. Ferroptosis, iron-dependent death. So cancer cells can sometimes escape one pathway, but these three pathways, they cannot escape them. There was the case of a man with Gleason score 9. His PSA was climbing. He started Fenbendazole combined with curcumin and CBD oil and other nutraceuticals. 6 months later, his PSA dropped by 60%. Now, here's the critical question. Why do these drugs work so specifically for prostate cancer? Because prostate cancer has 3 major weaknesses, and these drugs attack all 3 simultaneously. Weakness number one is their sugar addiction. Prostate cancer cells are metabolic junkies. They use the Warburg effect, that is burning sugar even when oxygen is available. Fenbendazole cuts off that supply. The cancer starves to death. Weakness number two is the fragile division machinery. Prostate cancer cells divide rapidly, and that's what makes them dangerous. But that rapid division depends on intact microtubules. Fenbendazole destroys them and makes the division to stop. The next is immune evasion. Prostate cancer cells evade your immune system, and so, but ivermectin disrupts the signals. Now, let's talk about safety, because this is where most men fail. Ivermectin and fenbendazole are remarkably safe when used correctly. Ivermectin, over 4 billion doses has been given with minimal side effects at proper doses. Fenbendazole has been around for over 50 years and has been used in animals and humans and is generally well tolerated. But this is critical. Most men who try this on their own make 3 fatal mistakes. Number 1, guessing the dose. Too little, it won't work. Too much, potential liver stress. So the dose matters a lot. Mistake number 2 people make, taking it without healthy fats. These compounds are fat soluble, so taking them without a healthy fatty meal means your body can't absorb them properly, so you are wasting the dose. Mistake number 3, not protecting your liver. And fenbendazole, they kill cancer cells by creating oxidative stress. However, this process puts a strain on your liver, so you need to support with supplements like milk thistle and todca, which are very essential and optimal, so that your liver is well protected. I've seen men fail simply because they don't know these critical steps. That's why I created a comprehensive guide. I've put together a completely free guide called the Prostate Cancer Repurposed Drug Guide. How to safely use ivermectin and fenbendazole without guesswork, without overdosing or making risky mistakes. Inside this guide, you get the exact doses men are using right now around the world, and that is helping them to get dramatic PSA drops. They must have supplement support to take with these drugs, blood tests you need to do to carry out to monitor your progress. This guide has actually taken me years to refine. It's based on real patient outcomes, peer-reviewed studies, and clinical monitoring, and I'm giving it to you 100% free. All you need to do is click the link in the description box right now. It takes you just 10 seconds to download. Don't be the man who tries this blindly and fails because nobody showed him the right way. The link is right there in the description box. Click it, download it, read it tonight. If this video gave you hope, here's what I want you to do right now. First, hit the like button. It tells YouTube that this video is valuable and they show it to more men who need it. Number 2, subscribe. Hit the notification bell. And then number 3, share this video with anyone or any man who you think might need this information. Remember to download the free guide, start learning, and let's win this together. I'll see you in the next video.